All right, so we've made it through the entire month of Hashimoto's, of April, Hashimoto's. And the last topic is one that comes up frequently, especially coming up a lot right now during this whole ordeal that we're having with the viruses. And the question is, or the topic is why is Hashimoto's becoming so common? And I mean, I've had a lot of time to think about this over the last couple of months, because in my mind it plays in with a lot of things that are happening right now with people being more compromised and being more vulnerable to getting the coronavirus, and some people reacting much worse. Continually hearing how compromised those patients are. It's really autoimmunity that's becoming more common. When I first got into practice, I was treating people who got well pretty quick. I was doing chiropractic, whether we was doing physiotherapy on them, whether we were giving them blood sugar diets, whether we were giving them supplements. I don't know. It was just like, okay, you're better. That's good. Let's see you later. And back then, autoimmunity was basically MS. It was rheumatoid arthritis, lupus, Lou Gehrig disease, which is still very rare. It was these things. It was things that you would know and grasp. But then it started to become understood that, and I do think it started with the thyroid. It started to become understood that the thyroid was actually, most hypothyroid was actually autoimmune thyroid. And the research on that is like irrefutable at this point in time. Even Mayo Clinic says 85 to 95% of all hypothyroids are Hashimoto's. But within the framework of being in practice during that time and seeing those patients and watching the explosion, I remember the group of doctors that I was with back then, we were all kind of like communicate with each other on board and go, does everybody have autoimmune? It was autoimmune at the time. And we were running autoimmune markers before anybody else was running them. They were telling us that we were crazy. And everybody was coming up. The ANAs were coming up on them. The antibodies were coming up. And then one of my mentors, said, let's test everybody for Hashimoto's. And I was resistant to it. Tested them. I tested the next 10 patients, and 7 of them had it. And I basically almost fell off of my chair, like, how could that be? So I think Hashimoto's kind of led the way to now, even in the medical community, they're embracing more and more that these mystery diseases, things that they can't put their finger on, could be autoimmune. And more and more autoimmune testing is being done. It's in its evolution, but the point is that we are developing autoimmunity as a common factor in our patient population, in our society. And I think, being my age and having gone through the 50s and the 60s and the 70s all the way up until today, had opportunity to watch the change in society. What challenges our immune systems? Our immune systems are amazing. It's like, how do you have a system that detects things that come into the body that don't belong there and either kill it or detox it without killing you? Think about that. Your immune system will attack a bacteria, virus, that type of thing. But in theory, it shouldn't attack you, except in autoimmunity. And now all of a sudden it's attacking us. And it would appear, based on the evolution of what we understand we need to do to dampen the immune response, that it's societal. It is indeed more stress. It is indeed people not sleeping properly, people going to bed late, the advent of television. Like when we were kids, television was from like 6 to 11. And then there was 3 channels, and that was it. Too many distractions. Of course, there's the cell phones. But even long before that, there was kind of the 80s is when things ramped up, and people started going, wow, I work 40 hours. If I work 50 hours, I can get ahead faster. And televisions creating situations in nightlife, creating situations where people were more likely to stay up late. And our circadian rhythms are off. Our sleep rhythms are off. Anybody knows anything about sleep knows that screws everything up. Society has changed. Relationships aren't what they used to be. People used to fight through them. The divorce rates were low. Now divorce rates are like, I believe it's like 50%. Don't hold me to that, but that's kind of what I have in my head. But it's high. It's high. Multiple relationships is difficult. Emotional trauma is rampant. Everybody comes in here is emotional trauma. Flares up stress hormones, damages tissue, sleep throws off circadian rhythm. Throw in the now pretty well-known mitigated foods, the mechanically, genetically modified foods that are now foods that our gut sees as maybe an antigen, as a foreign body that's tearing up our guts. Start looking into like gluten and nightshades and lectins, and some for others. But we're getting responses to these foods now. The foods aren't what they used to be, and they're harder to digest. And then sugar. We used to eat 2 pounds of sugar to 3 pounds of sugar a year 50 years ago. Now we eat 2 pounds to 3 pounds of sugar a week. It used to be like a confectionery that was really expensive, and it was a treat that you got on a certain time. Sugar's killing us. Sugars are killing us. We're beating up our intestines, so we're getting food sensitivities, and now we're getting these food sensitivities because our digestive processes are breaking down because of stress, and so we're getting we don't even know we have food sensitivities. But when the digestive process breaks down, and you're not digesting in your stomach, and your gallbladder is not working, and your pancreas isn't working, or they took out your gallbladder, or they put a sleeve on your stomach. These things interfere with the ability to digest. You now have a food particle that goes into your intestines and looks like a foreign body. So your immune system attacks it. Now everybody, your grandmother, has food sensitivities and or food allergies. So we have all of that. We have blood sugar all over the place. Who isn't diabetic today? People are overweight, so you have insulin surges, they go up, they go down. These are things that our bodies did not have to deal with. And once you start having that occur, once you start having that breakdown occur, now viruses, bacteria, molds, these types of things that didn't bother us before because, you're kids, you heard it. You're out there, you're playing around, you're eating the dirt, in your mouth from somebody playing, and you're getting into there, and that's was creating a good immune response, a good immunity. What we're talking today is about herd immunity to different things. All of that is more it's more difficult for our immune system. Our immune systems are like now they're just like they're like going down. They're like going down. And they can't handle killing these things. Your hydrochloric acid in your stomach is supposed to kill these things before they ever get into your gut, these bacteria. They find, half the people coming here don't have hydrochloric acid in their stomach because they're stressed out of their mind, and they got a thyroid problem, and they got SIBO and all these other different things that they never got before. At least very, very rarely did they get these things before. All that breaks down our barrier systems. All that breaks down our gut. Everybody's heard of leaky gut. But those of you who have bronchitis, asthma, so there's breaking down the barrier systems here, athletic asthma people, those types of things. People who've had concussions. Concussions, I'm sure, have always been around. But with what I'm talking about, the immune system in the brain is so much more difficult for the immune system in the brain to be able to dampen the inflammation there. And, just that, lifestyle changes, diet, those types of things need to occur for us to dampen this. Why Hashimoto's? Hashimoto's is probably more common than all of the other autoimmune cases put together, all the other conditions put together. If you have Hashimoto's, you can have parietal cell antibodies, and you can have autoimmune gastritis, you can have autoimmune hepatitis, you can have polycystic ovarian syndrome, you can have celiac, you can have autoimmune antibodies against your cerebellum, you can have all sort of usually you don't just have Hashimoto's. Rheumatoid arthritis is very closely related to Hashimoto's. So I think it's just because Hashimoto's is a thyroid, and the thyroid is what controls your metabolism. it has receptor sites in every single cell in your body, every single cell. So no matter what happens in your physiology, no matter which of the other systems go off, they're going to affect your thyroid. If you get a little inflammation, it's going to affect your thyroid. If you get bad gut bacteria, it's going to flare up your immune system and it's going to affect your thyroid. So I've never really thought that directly about it until I was presented that question. But that's how you think about it when a patient comes in, or that's how your doctor should be thinking about it when you come in. And Hashimoto's is a very complex thing. It's why it's so difficult to get the labs right, because the labs can be all over the place because so many things can affect your thyroid. Blood sugar affects your thyroid, not even if you didn't have Hashimoto's. That's even possible. Stress affects your thyroid. So there's so many vicious cycles, but they all touch your thyroid, or they all touch your thyroid hormone in some way, shape, or form. So I'm pretty sure that that's a competent answer as to why Hashimoto's is explained. I'll tell you another thing. If you're a female and you have a mother and you have a sister and you have a daughter, there's a good chance two of them have Hashimoto. And you have Hashimoto's, there's a good chance two of them have Hashimoto's. So it's creating genetic modifications that are being passed on. And so we're starting to see third generation Hashimoto's. I've seen now 2 in the last year and a half, 2 years. I've seen 2, and I don't treat a lot of kids. That's putting it mildly. Okay, I treat even fewer 3-year-olds, but I've seen 2 3-year-olds in the last 2 years that have Hashimoto's, that tested out positive for Hashimoto's. So that's pretty mind blowing. So I think that's the answer. I hope you've enjoyed this series. I've enjoyed doing it, and we'll see what we get onto for next month. All right. So send me your questions. Send me any questions you have or anything like that. If we can answer them, we will. If we have time to answer them, we will. If we don't have time to answer them, we won't. But send them to me anyway. So I'll see you again